Coronavirus Facts, Not Fear. I'm Stephanie Perugian. And right now, the state is looking for ways to keep communities of all kinds safe while the threat of COVID-19 remains.
The issues of race, the issues of racism, the issues are a big part of the real work that we have in front of us as it relates to addressing the issues of public health, public safety, and economic growth and recovery.
Was Governor Gavin Newsom last Friday addressing the disparities impacting communities across the state when it comes to getting care during this COVID-19 pandemic. He showed slides pointing to the Black community's higher percentage of deaths in comparison to the state's population. But how does the Central Valley fare when it comes to communities receiving the same care? We're now welcoming Dr. Tania Pacheco-Werner. She's a research scientist with the Central Valley Health Policy Institute. Dr. Pacheco-Werner, thank you for joining us. And why don't we start off by having you first explain the work of the Institute. What exactly is done there?
Yeah, so at Fresno State, we have many research institutes, and this one in particular is committed to the health equity of the Central Valley, and that means that do work about anything that may impact health outcomes and how we can make sure all of our population have an equal opportunity to thrive in our valley.
And what is the situation in the Central Valley? Is it equitable, or are there disparities? What are you seeing in our valley communities?
We see that we have our work cut out for us. Definitely when it comes to individual diseases like diabetes and heart disease, we see disparities, but we also see that the cumulative impact of where people live and the air they breathe begins to impact them since birth. And we studied term birth at the Institute, and we also studied death rates, and we see that people have from the beginning an unequal start that we see at the very end, where we can see, depending on your zip code, you may live 20 years less than your neighbors.
Which is shocking and alarming, and clearly that is something that needs to be addressed. Is this an issue with comparing rural communities to people that live in the cities, or where do these disparities primarily occur?
We definitely see disparities when it comes to rural areas in terms of accessing care too late, but we also see that this is primarily a racial disparity in that we see that African Americans across the board will be disproportionately impacted by so many things like policies and healthcare discrimination and just any outcome. We see that African Americans will be disproportionately affected, and they are Latino and Asian communities will see the language barrier really work against them in terms of managing diseases and really also where they live and like I said, the air that they breathe as well.
How do our figures and the results of the studies that are being done locally compare on the nationwide level among African American communities nationwide? How do we rate in comparison?
Unfortunately, in the Central Valley, what we see in our disparities is some of the worst of what we see in the country. And this is not only extends to health and health care, but it also extends to our economy. And we end up having some of the widest gaps between white and Black, white and Latino populations than we see anywhere else in the country. So this is a real good opportunity for us. Like, there's no other place to go but up, in terms of how we work together to address these.
Okay, I guess that is definitely something that needs to be addressed clearly, as you're describing to us. So what can be done? This is obviously a major problem that spans decades, if not longer. How do you address something that's so vast, that problem that's so vast?
I think that one of the first things that we do is when attempting to address an issue like healthcare access or how people interact inside a hospital, we must always think about training anyone from front desk to a surgeon with the capacity to understand disparities by race and language that we see so that they are really equipped to address this. And also, like we're trying to do here in the city of Fresno, really center our economic recovery around racial equity and addressing these disparities. And as our transportation folks are trying to do, address those rural access points so that people can really, where they live doesn't determine how well they'll have access to something like healthcare.
Well, we appreciate your time, Dr. Tania Pacheco-Werner, for enlightening us about this serious problem nationwide and certainly in our own community. And we'll look forward to hope to see some solutions in the future. Thank you for your time.
Thank you.